Hi, everybody. Thank you so much for joining us tonight. My name is Monique Hill, and I am the producer of tonight's webinar. Tonight, it's Texas Fertility Center's webinar on exploring male infertility with Dr. Anthony Propst. We're so excited you're able to join us. I think you're going to find this to be incredibly informative. And these webinars come to you at no charge. It's an amazing way for you to learn about all different types of topics of infertility and fertility, and you have an opportunity to not only learn from various doctors at Texas Fertility.
Could you ask them not to fight?
I'm so sorry. I lost the connection at the
I did
World
too.
Webinars. Okay, good. I wasn't the only one. Maybe everybody's joining back in. Welcome again to the webinar on male fertility, exploring male fertility with Dr. Anthony Probst with Texas Fertility Center. You can find information on these webinars at txfertility.com/event or /webinars. We have these webinars the third Thursday of every month. The next event will be on July 15th, and it will be Should I Freeze My Eggs? It's always an interesting topic. There's always the discussion between fresh versus frozen, so you'll want to join that one as well. So I don't want to delay any longer. I do want to let you guys know that you do have an opportunity to ask Dr. Probst some questions. So we will stop halfway through, and then again at the end, you'll see a tab on the right of your screen that says questions. If you hit that tab, then you can put your questions in there. I do want you to know that your information is confidential, so please don't worry about any of your information getting out. Feel free to ask any questions you'd like, and we will get to as many questions as we can before the end of the session. So now I'd like to bring on Dr. Probst.
Thanks, Monique, for that nice introduction. I'm Dr. Tony Probst, Texas Fertility Center. I'm a reproductive endocrinologist. A reproductive endocrinologist is an OBGYN who has done a fellowship or subspecialty training in infertility. And so I focus on fertility treatments. And in order to have a baby, you need to have an egg, you need to have a sperm, and you need to have a uterus. And so the male partner is a big component of both producing a pregnancy as well as contributing sometimes to infertility. And so we know that maternal age is the strongest predictor of fertility outcomes for couples because as women get older, they tend to have fewer eggs and eventually will run out of eggs in the menopause. For men, it's not the same issue. Men will continue to make sperm throughout their lives, but low sperm counts or other medical conditions can contribute to infertility. And about 40% of couples will have male factor as part or all of the reason for their infertility. So when we see a couple who are trying to get pregnant or having difficulty, it's very important not only that we interview the woman and do an evaluation for her, but that we do a reproductive history of the male and also a semen analysis. The semen analysis is a test that will tell us really what is the overall count, the motility of the sperm. And the way it's evaluated are four things. One is the volume, the amount of semen. Second is the concentration of sperm within the semen. And the normal concentration would be 20 million or more. We also look at the motility, the percent of sperm that are moving and how rapidly they're moving. And in general, in normal semen analysis, you'll see 50% or more of the sperm that are moving in a line or rapid basis. And then the last category is morphology. That is the percentage of normal shaped sperm. A lot of sperm have some misshapen, either their head or their tail, but we consider normal morphology 30% or more of the sperm are normal shape. And when you see lower rates of morphology, that can affect the ability of the sperm to fertilize an egg. If we find that somebody has one or more abnormalities in the semen analysis, we'll often repeat that a month later because there can be quite a bit of variety over time, between a man's semen analysis. But in the event that we see a persistent low count or motility or low morphology, oftentimes we'll work with our urology colleagues, so male reproductive experts, in order to evaluate and also do a complete history and physical examination. A lot of people ask about lifestyle issues. What are some lifestyle things that can affect sperm? One is diet. There's not any unique diet for semen that is best for sperm, but in general, a diet that's lower in fats and meats, more vegetables, tends to do better as far as sperm production. Smoking is a thing that can affect the overall sperm concentration as well as the motility. It can have negative effects on male infertility. One thing I see sometimes is men will come in with a really, really low sperm count or no sperm at all. And then taking their history, you realize that they have been taking testosterone injections for low T or low testosterone. It's very common. They'll feel tired. They'll go to one of these low T centers. They'll say, hey, your testosterone's low, take some testosterone shots. And they'll feel better, but then they'll start trying to have a baby and they're not getting pregnant, and they realize the low testosterone basically will shut off the production of stimulating the testicles to make sperm. So some people think, well, testosterone is a good thing, but you need the stimulation of the testes to make the testosterone to also produce sperm. Another topic that comes up is men who have cancer or serious medical conditions that could require chemotherapy or radiation. And these are medications that are toxic to the gonads in a similar way that they're toxic to eggs. And so we're always counseling teenagers or young men, anybody who has not completed their family, who thinks they may want to be a parent in the future, then in the event that you have need for radiation or chemotherapy due to a cancer diagnosis, that you should freeze sperm ahead of time, and that sperm can be used in the event that the chemotherapy or radiation causes a negative effect on your sperm production. All right. Why don't we just stop there and see if there are any questions about that general overview, and then later we can talk about different treatments.
Okay, I have some questions for you, Dr. Propst. You had mentioned not smoking. What about smokeless tobacco or snuff? My husband does that. Should he stop if we're trying to get pregnant? There's no good data on that. It's not a bad idea for health reasons to do, but we don't have anything that's sort of just nicotine as opposed to the smoking has a negative effect on sperm. Similarly, we don't have any great evidence that alcohol use affects sperm production. We do one drug that has been shown to have an effect is marijuana. So high uses of marijuana can have a negative effect on the sperm, and so should limit or hopefully stop using marijuana while you're trying to conceive. Another one people like to think about, caffeine. Caffeine does not appear to have an effect on sperm production. So smoking is the one that we have the best evidence having a negative effect, but the other things, trying to live a healthy lifestyle while you're trying to get pregnant is always recommended. I'm sure she will not like that answer. She probably won't. Yes, as a former dipper myself, I will say switch to regular gum and then quit. Good answer. How accurate are home semen testing kits? Would you recommend them?
I don't know the answer to that. I've had more and more men tell me that they're doing them, but I don't know much about them myself. I can't give an answer if they're accurate or not. I don't really understand the technology and how they're doing it.
Okay. And then in relation to that, if somebody does come into your office to do a sperm analysis, how long does it take to get the results back?
Usually 2 days, 1 to 2 days. So they will do the analysis about 20 to 30 minutes after the sperm is ejaculated. And they'll do a report that day, and then usually it'll come to the doctor that ordered it, and then that doctor will share the results with the patient.
Okay. I know in other webinars we've done on this topic, one question that's been asked is, what is a low sperm count number? Do you have a number that you would?
So technically anything under 20 million per cc, or that's a volume of unit, is considered low. But practically, what we start to see is when you get total motile counts, the total number of sperm that are moving, if they are less than 10 million, we start to see lower pregnancy rates. And for fertility treatment, when you're getting total counts less than 5 million, usually intercourse or insemination doesn't work. And most of those couples will need to go on to in vitro fertilization, and if we can't get the sperm count better.
Okay.
Leland, please.
Which you guys are going to be having an in vitro orientation in September. If I can do the plug on that there, it's a good time to kind of throw that out there if you're looking for information on IVF. Do you want some more? Do you want another question?
Sure.
Okay. I was told I have a low sperm count. How do I know if it's due to duct blockage that could be fixed with surgery? I don't want to have surgery if I don't have to.
Yeah, so usually if there's a duct blockage, that usually results in no sperm, okay? The other time we sort of see that is like men who've had a vasectomy and a reversal, and the narrowing is less. And so if you have sperm in the ejaculate, but it's not, the count is low, that's usually not due to an obstruction. So usually that's going to be treated medically or with fertility treatments.
Okay. And then the last question we have for now is, I'm an older male. Do I need to worry about my child having autism, schizophrenia, or another genetic abnormality?
Yeah, I mean, that's a good question. So higher ages of paternity, typically we define that as 55 and older, you do start to see some higher rates of autism. You also start to see some de novo mutations. That is where you don't have the trait, but your sperm has produced an abnormality within the sperm, and that can lead to things such as dwarfism. And then, also higher rates of schizophrenia in children from men of older age. But you got to remember, so that's a relative risk compared to younger men. Still the chances of that happening are still the total risk is absolutely pretty low. It's just relative to younger men, the risk of those sorts of disorders are higher among men who are 55 and older.
Good to know. That's a great question. Okay, one more just came in. Can high sperm count offset or balance out other issues like morphology, motility, etc.?
Yes. So again, it's a function of motile sperm. So say you're a man who has 200 million sperm, but only 25% are motile. That's still a good sperm count. You got 50 million motile sperm. But say you have 10 million sperm, but 30% are motile. Now you're down to 3 million, and your chances of conceiving naturally or even with insemination are much lower. So it's a combination of all the characteristics.
Okay. I can disappear if you have some more information.
Okay, sure. So
I'll be back.
So let's talk a little bit about what we do when we diagnose a male with low sperm count. Again, the biggest differences are, is the count normal? That's going to affect treatment one way. Is the count low? That affects evaluation and treatment another way. And is there no sperm? Because that, you've got to have sperm to produce a pregnancy. That's going to be treated in different ways. And I'll sort of go over the low sperm and the no sperm. So the low sperm count, again, we're trying to find out why that is. Oftentimes we'll refer you to a male reproductive expert, urologists who have additional training. They'll oftentimes do an evaluation, a physical examination, perhaps an ultrasound. It's very there's a condition called varicocele, which is a dilated vein around the testicles. That is a common condition in men. For some, it causes some symptoms, some pain, and other issues, but also can affect the sperm and the quality of the sperm. So one thing to consider is possibly having the urologist fix that varicocele. Oftentimes that will improve sperm counts and enable natural fertility to occur. We're more likely to recommend that in younger men or men who have a younger partner where there's not as much of a concern with the female age, because fertility treatments are usually only effective to the low 40s for most women. Oftentimes they'll also do a hormonal evaluation to find out if your hormones are sufficiently stimulating the testicles to make the sperm. So we're looking at things like follicle stimulating hormone, testosterone, and in fact, we see a low testosterone, the testicles not being adequately stimulated. We can use medications then to effectively improve sperm counts and fertility treatments. When it comes to deciding what sort of treatment we're doing for a couple, again, we will look at the overall sperm count. If the count is low but reasonable, we'll oftentimes recommend a procedure called intrauterine insemination. That is where you take the semen and you wash it through a centrifuge to concentrate the sperm, and then place a small volume of sperm within the uterus around the time that the woman is ovulating, can improve pregnancy rates. In general, you want to have 5 million or more total motile sperm for that to be effective. The success rates are much less for men who have a lower sperm count, particularly those counts that are 2 million or less. For men who have a very low sperm count, or the other, like I said, 2 million or less, or the other fertility treatments are not working, oftentimes we'll go to in vitro fertilization as a method. And so in this process, you don't need a lot of sperm. You could actually, if you had 15 eggs and you could get 15 motile sperm, you could help fertilize all of those eggs with a process called ICSI. That is where you inject a single sperm into an egg. The title for ICSI is intercytoplasmic sperm injecting. So you're injecting that egg, or taking the sperm, putting a needle through the wall of the egg into the cytoplasm and placing that sperm next to the nucleus of the egg, so that it can fertilize and then develop into an embryo and then hopefully a baby. For men who have no, when they do the semen analysis, there's no sperm, oftentimes then they'll see the urologist to try and find out why they're not producing sperm. It could be a blockage in the testes, or not in the testes, but in the tubes that lead from the testes out through the urethra, where ejaculation occurs. And then they may be able to have surgery to fix that blockage, or they may need to have a sperm aspiration procedure where you go into the epididymis or the testes in order to get sperm to do fertility treatments. The sperm aspiration is done under anesthesia. It's done by a urologist who's specially trained in that. The sperm is then frozen. We don't get enough sperm to do inseminations, but it can then be used for in vitro. And that is something that we do for some men who have no sperm in their ejaculate, but they're able to get it from their testicles. Let me stop there and see if there's any questions about that sort of fertility treatment options.
Okay. Do hot tubs and hot showers negatively affect sperm quality?
There's the possibility of that, for sure. I mean, there's a reason that we formed the way we did, where our testicles are outside of our body, because high levels of heat can damage sperm and damage the sperm production. There are some men you see who have a condition called undescended testicle, where at birth and during childhood, their testicles did not descend down into their scrotum. And oftentimes those men, even after they've had that repaired, will have very, very low sperm production because the heat damaged the testicle. With a hot tub and sauna type thing, it's more likely that that heat is just affecting the sperm that are being produced there. TFC or I'm sorry. But it's a good idea to avoid that. Another thing we see, especially in Austin, there's lots of cyclists. So people who do a ton of cycling that are on their bicycle, especially in the summer months where it's so hot, it can really create an environment where there is a lot of heat. And so I'll recommend to some men who to limit their cycling, especially in the warm months of the year.
Okay. You had mentioned washing sperm for IUI, and somebody asked if this reduces the likelihood of miscarriage due to genetic abnormalities.
No, it doesn't. So, interestingly, most chromosomal abnormalities that lead to a miscarriage are chromosomal abnormalities that come from the egg. It's something like over 90%. Sperm tend to have fewer chromosomal abnormalities, but washing or doing the IUI doesn't affect that, and there's no way of able to test the sperm for those abnormalities. The only way we have of testing before implantation is to actually test an embryo, which is an egg that's been fertilized with a sperm, and then it's produced an embryo. We're able to do genetic testing through that when we do in vitro fertilization, but we don't have a way of testing the eggs or the sperm for chromosomal abnormalities.
Okay. If there's sperm damage from high heat or cycling, I think this came from you answering that question, you have to wait for a full 3-month sperm generation time to regenerate viable sperm. Is that true? Do you have to wait a full 3 months?
It is true that the lifespan of a sperm is over 70 days. So from the time it starts as a spermatid, which is the earliest phase of it, to the time it's a mature spermatozoa, which is what it is right before it's ready for ejaculation, is about a 70-day process. So you're right. If there was an illness or lifestyle issues or event that caused damage to the sperm, it may be several months before this sperm improves under the new environment.
Good question. Never heard that one. You mentioned lifestyle earlier in your in the speech. Can supplements like zinc and vitamin C be good for increasing semen?
They're probably not. I mean, they're probably not harmful. We don't have any evidence that they help. And that being said, most doctors will recommend strong swimmers or brand of vitamins or Conception XR, but there's very limited data that these antioxidants and other minerals and vitamins really have an effect on the overall quality of the sperm. So they're not that expensive, so I don't feel too bad about ordering it. But I can't tell you we have good evidence for that, and it's the same thing for women's supplements too. We try things that we think may help, but we just don't have good evidence from studies that they do.
What about cell phone usage, limiting cell phone exposure? That's another thing that
I think about that every now and again. Sometimes I'll ask, man, we don't have great studies on that, but you go think about it. Especially you walk around with a phone in your front pocket, sitting 2 inches away from your testicles for 12 hours a day. It could have an effect. It's probably a good idea to to avoid that. But again, there's no good studies that show what effect it's had.
Okay.
In general, sperm production has decreased. If you compare semen analyses now to 50, 60 years ago, male infertility rates are higher. Overall, the sperm production is less. We don't really know why that is. It could be different hormone receptors that are out there, or plastics. There's a lot of theories. We don't really know why, but sperm, the amount of sperm has definitely changed in men now as opposed to 50, 60 years ago. So something is in the environment or lifestyle issues that are probably causing that.
Wow, that's interesting. Keto diets are very big right now. Somebody asked, will being on the keto diet, which is a high-fat diet, negatively affect sperm count or motility?
I don't know of any evidence of that. In general, it's recommended, that's a high-fat, high-meat diet. The general recommendations from the American Society of Reproductive Medicine and American Urological Association would be to have a diet full of more vegetables. So it sort of go against that. Again, it's pretty limited data that we have on diet, though, and reproduction, both for males and females.
That's all I have for questions for you.
All right. I need some more questions.
Another one came in. What are some ways to address white blood cells in semen, and why might they have them in the first place?
Yeah, so when they do the semen analysis, they'll look at those. So they'll look at round cells. And so round cells can either be white blood cells or they can be immature sperm. If they're white blood cells, it usually indicates that there's some form of inflammation or infection that's occurring along the genital tract. In that situation, oftentimes we'll either refer you to a urologist, or we'll do a course of antibiotics for several weeks and then repeat the semen analysis to see if that has occurred. And that infection can be anywhere along the tract, in the prostate gland, in the epididymis, and that can cause, doesn't affect the sperm so much, but it can cause, pain, irritation, and it needs to be corrected.
That's all I have for questions. I do think that at this point it's good to I thought I'd let everybody know that, again, we are having an IVF orientation in September, so that'll be good time to get some information on IVF. And then in August, it's the third Thursday of every month. In August, it will be your first fertility evaluation. So if anybody's new to fertility, that might be a good time, if you have questions, to join that webinar or join with family, partners, whoever might want some more information. And then again, July 15th will be, should I freeze my eggs? Which I know is always a really big question now on the fertility front. So I really appreciate your time, Dr. Propst. It's always so nice to have you guys here giving us some information and putting some faces with names outside of just the internet sites.
And thank you, Monique, and thanks to everybody who joined the webinar. I hope it was helpful. And please reach out to us if you have questions about your fertility. We'd love to help you.
Thank you. Have a good night.
Good night.
Good night.